Hello, Randy Magas, Doctor of Chiropractic. I want to talk to you about your tailbone. Your tailbone, as you know, sits down on the bottom of your spine, and you don't usually think about it much unless you have problems with it. So there are people who have tailbone pain, but you don't have to live with tailbone pain. Something can be done about it. So when someone comes into my office with a tailbone issue, the biggest complaint is there's pain there. And usually there's a history that they fell on the ice and fell directly on their butt. They've probably been lifting too much and suddenly now they're having pain down there. Or they tell me they've just had a baby and the tailbone's been bothering them ever since. So the tailbone is really a neat part of the body. And so you have your whole spine, and as you know, the spinal cord comes down the whole spine, and it stops about there, and from there, nerves come down. Well, the nerves come all the way down into the tailbone. So also with the tailbone is it's connected to tendons and ligaments in the pelvic area, and that helps to control the organs that are down in the pelvis. So along with affecting pain, people can have problems with their bladder, and part of the problem can be that that tailbone is out. And so people can also have problems with solid waste, and that can be part of the problem, can be the tailbone. And often in those cases, I work on the low back, this SI area, and the tailbone area. Also, women who are having fertility problems can have problems with the tailbone, this low back area, and getting that adjusted can help significantly. When I assess someone, usually I work out the low back, work out those muscles, work out the muscles down in the tailbone area. And what I'm feeling for when I palpate that is it can be forward, it can be turned to one side or the other. And normally when I adjust the tailbone, I use this here spring-loaded mechanism. If this is pushed out this way, I just get on the tailbone and I fire that instrument, and that helps to push the tailbone forward. Most people don't complain about it hurting. Some people have a little bit of pain there, but it's mostly because those muscles and tendons in there are really tender. And after a series of treatments, that will get better, and they won't have the problems that they had when they came in. So if you have problems sitting because your tailbone hurts you, if you have problems working, low back pain connected with your tailbone, if you're having bladder problems, if you're having reproductive problems, it's worth getting this area assessed and having it looked at so you can go on and live the life that you deserve.